Welcome to Pharmative Live. My name is Dr. James Partyka. I'm a clinical pharmacist. I'm an oncology research scientist and the founder of Pharmative, Pharmative.com. Pharmative is all about connecting patients to healthcare professionals and scientists in order to educate ourselves so that we can make informed decisions with our healthcare professionals. So that's Pharmative.com, and Pharmative Live is sponsored to you by our PNN.1 Plus Health mobile app. You can download your app today at your Apple and Android stores. It has a lot of great music, entertainment, news, but it also has Pharmative and a number of vital healthcare resource tools so that you can make informed decisions about your medical therapy with your doctors and nurses and pharmacists. So this is Pharmative Live, and today we're going to be talking about what the heck are monoclonal antibodies in the treatment of COVID-19. But before we do that, I just want to remind you about last week's topic, which was developing your own healthcare journal. Whether you do that on your phone, your iPad, or in your own manual notebook. What's great about Pharmative Live and having your own healthcare journal is that if you switch doctors, or if by any chance you're admitted into an emergency room or move to a different location, a different state, you can then take your healthcare journal, which will list all of your current medications, your current medical history, as well as if you have any known drug allergies. And that's great for you to have as a living document. You update it on a regular basis. Again, the most important information that you would want a doctor or a nurse or a pharmacist to know about what kinds of medications you're on, what's your past medical history, and if you have any drug allergies. And not only can you do this on your phone or your iPad, but you can actually take pictures directly from your notepad, take pictures of your insurance card, of your vaccination history, if you've been vaccinated for COVID-19, and anything that you feel is important. You carry this around either on your phone, on your notepad, or on your journal, and that's our way of basically minimizing the risk of mistakes, of medical mistakes. And for people that are taking care of you, they know for sure what medications and what dosages and what your current medical history is if you are admitted to an emergency room or changing doctors and so forth. So do it today. I did it for myself. I did it for my partner, Jimmy, who's out there watching. And I suggest you do it today. Again, it's a living document. So write down the most important dates, most important things about your medical and drug history in your healthcare journal today, and that will help you minimize mistakes in the future if, God forbid, you're admitted to an emergency room, or if you were admitted to for specific medical care. They know what medications you're already on, and that will minimize mistakes. So today we're going to be talking about what the heck are monoclonal antibodies. But before I do that, I want to say that we're sponsored by our PNN.1 Plus mobile health app. You can download your app today at your Apple and Android stores. Not only does it have great music, great entertainment, but it also has a number of vital healthcare resource tools that will give you access anywhere that you're connected with limited commercial interruptions. That's the PNN.1 Health mobile app. So download your mobile app today. So with that, today is February 21st, and it's 2021. And start off by saying some statistics regarding COVID-19. 28.1 million cases have been diagnosed in the United States, and we're rapidly approaching 500,000 deaths. Although the good news is that the case rates are dropping, and it's unclear as to why, but that's a good thing as well. But we certainly are in the middle of a pandemic, and we don't know what the future is going to bring with regarding the emergence of mutation strains and so forth. So we got to continue to practice our precautionary measures by double masking up, by social distancing, staying home, washing your hands, use hand sanitizers, and all of the things that you need to do, whether you're vaccinated or not. We have to continue to do that, again, to decrease the spread of disease. For those of you that are about to get your vaccines, I would, again, encourage you to listen to your local public health officials, local news, as to whether you qualify to get your vaccine. That's based upon age, it's based upon your occupation, and certain risk factors. But you have to be proactive. You have to stay aware of your local news and where you can get your vaccine. I have friends that were able to go to CVS.com. I'm not promoting CVS, but they were readily available, a number of appointments at their local CVS, and they were able to obtain their first vaccine shot. So that's good. Now remember, if you're getting Moderna, you get 2 shots 4 weeks apart. If you're getting the Pfizer vaccine, you're going to get them 3 weeks apart, and you are not going to mix vaccines. So once you start with the Moderna vaccine, you stay with the Moderna vaccine. Pfizer, stay with the Pfizer vaccine. You can get those 2 shots. There's a lot of discussions about possibly for some people only needing 1 shot, but again, that's against the clinical trial data that we have by both Pfizer and Moderna, which definitely shows the importance of 2 shots in boosting your immune system against the vaccine. But what I want to say to you all right now is be proactive. So more and more vaccine is becoming available through the United States. We're hopeful that a 3rd vaccine, the Johnson & Johnson vaccine, will also be available soon. Be proactive in making your scheduled appointments for those 2 shots, because the vaccine is going to provide you with a certain level of protection by producing antibodies against the spike protein on the virus. So if, unfortunately, the virus invaded you through your nasal pharynx, through your respiratory system, you will be armed and ready to have antibodies against the virus. So again, now for those patients that are having symptoms of COVID-19 and test positive for COVID-19, I want to make you all aware today that there are medications called monoclonal antibodies available at various infusion centers throughout the country. So this is something that was approved in December by the FDA for national emergency use. And it was just the data published in the New England Journal of Medicine last month on the 21st. And you're going to say to me, what the heck are monoclonal antibodies? And it's very simple and very easy to explain. Mono meaning 1, that there's a specific target that we can engineer these antibodies in a laboratory that is directed towards the spike protein of the COVID-19. So for those people who have contracted the disease, have symptoms of the disease, test positive for COVID-19, they can receive immediately these monoclonal antibodies, which are targeted directly for the virus. and that sets up a cascade of immunologic cells and cytokines so that you can decrease your viral load, decrease the need for medical visits. And we know by science, if we decrease the viral load, that decreases your risk of death. So the clear, concise message that I want to relay to all of you, if you're sick with the symptoms of COVID-19, fever, difficulty in breathing, and you test positive for COVID-19, you want to ask your doctor immediately, are you a candidate for monoclonal antibodies? There's two companies, Regeneron, Eli Lilly, that produce monoclonal antibodies. You might have heard of the cocktail. They are available to you, and I believe they're available to you free of charge. And again, the importance of it is you got to get it early in the treatment of the disease. It decreases the viral load. And again, these are engineered antibodies. Now, when you get a vaccine, right, your own immune system, which takes days to weeks, will produce those antibodies against the spike protein to prevent you from getting moderate to severe disease of COVID-19. If you did not get vaccinated and you are susceptible to COVID-19 and you think you tested positive and you have symptoms, you want to call your doctor right away and see if you can get these monoclonal antibodies. They'll infuse those antibodies directly into you that will fight immediately the COVID-19. So mono meaning one, clonal antibodies. These are multiple numbers of antibodies which are specifically targeted for the spike protein on the COVID-19, which will set up your immune system quicker to fight the virus. So that's all that is. Basically, your vaccine shot would do the same thing, but that takes weeks. If you have COVID-19 and you test positive and you have the symptoms, you want to get an infusion of these monoclonal antibodies. The side effects are generally limited to infusion-related reactions. So the benefit of reducing the viral load immediately through these monoclonal antibodies, through these cocktail antibodies, far outweighs the risk of developing infusion-related reactions, which will be monitored closely in the clinic or in the hospital. And those monoclonal antibodies will target immediately the COVID-19, and that will decrease the viral load, which will decrease your risk of death. So we all know this is a life-threatening illness, and we want to take every measure we can to either prevent the disease or treat the disease as early as possible. That's Pharmative Live for today. I welcome your questions. You can send your questions to info@pharmative.com, or you can always text me. Right now, I'm being told that I look a little blurry. That's technology for you. Hopefully you can hear me. And I will make this episode and all our episodes available not only on Pharmative YouTube, but also on Pharmative.com. I'll see you next week. And in the meantime, stay healthy, as it's easier to prevent disease than to treat disease. So take care, enjoy the rest of your weekend, and I'll see you next week.